when they are assisting patients with medical situations that might involve controlled substances. So we'll just take our first step, and it'll be a kind of maybe a little bit of a basic one, and you might or might not know this, but a little bit of background on the PMP itself. It is the officially called Controlled Substances Prescription Monitoring Program, but we have truncated that to the PMP, and that's what I will refer to from here until we finish today. It is, of course, a database that medical professionals can access when they are taking care of a patient. There are also some additional folks that have access as well that we'll talk about in just a little bit. The reason why it resides in the Board of Pharmacy is because it tracks all dispensations of controlled substances, and most of those are done by pharmacists. So that's why it resides in the Board of Pharmacy itself. Just a couple of little quick facts that you might or might not know about the PMP. Actually, the Arizona State PMP started in 2008, so we do have records going back to that time. At the moment, we are connected with 36 other states, with one of those being the Military Health Services. And the question we get quite a bit is, why are you not connected to all 50 states? Every state has some form of PMP, but because of statutes, there are some that we can't connect to. We are connected to all of our bordering states except California, but that is something that we hope in the future will be remedied, because that is a big chunk of data that we wish that we had. This database is actually quite large. I think this figure surprises everybody that we share it with, but in 2008 there were actually 8.9 million queries to the database. So it has a lot of information. It's used quite a bit, but we want more people to use it, and that's why I'm here today. The main report, and we'll just go through this really quick, the main report of the PMP is the Patient Utilization Report, and I will just briefly highlight some of the things that you will see here. As you are caring for somebody and you feel that there might be controlled substances, might be a course of treatment for them, you of course would pull up a patient utilization report, and all you really need is first name, last name, and date of birth for the patient. One thing to keep in mind as well too is if the patient uses different names, or maybe they've had a name change, keep that in mind when you are searching for patients. By default, when you look up somebody's report, it's for the previous year, and that satisfies the statute, but you can look up for a longer period of time just by setting different criteria for your search itself. Also, if you have, let's say, you are taking care of a Leonard, or Lenny, you can do a partial search where you put LEN, and all three of those will come up. If you do have multiple names for a patient, there's also a multiple name field that you can use as well. This next slide talks about, this is really the meat of the report itself, of course. This gives you the history of your patient and the controlled substances that were dispensed to them. A couple of things that are very important in this regard is you can tell, when it was filled, when it was written, quantity, the days of the prescription, more importantly, the prescriber and also the pharmacy itself. So if you do have a question about something was dispensed to the patient, you have that information where you can reach out to another medical professional. You also have the RX number, the prescription number as well. So it's very important. One thing that we do tell people is this is not the total, complete, perfect record for your patient, but it will give you a good idea of what's going on with them. If you do have to reach out for to another medical professional, it does give you the list of prescribers and dispensers that were in that report. Okay, so this next part is not the sexy part of the presentation. We're going to talk about statutes and that type of stuff, and a lot of what I'm going to talk about today came about because of the Arizona Opioid Epidemic Act that was put into place by the legislature, a lot of people working, and then signed into law by Governor Ducey. So first let's talk about registering for the PMP, and that's what, of course, the first step. If you are a prescriber and you have a valid license from a state licensing board and you have a valid DEA registration number, you must be registered with the PMP. Sarah, are we okay?
Yes, I'm sorry. I just took a minute to find who that was causing the feedback.
Okay, good. Okay, good. So let me just kind of go back a little bit. So if you are a prescriber and you have a valid license from a state licensing board and you have a valid DEA registration number, you must be registered with the PMP. Even if you are not prescribing controlled substances, but you meet those two criteria, then you must be registered with the PMP. It's easy to do. It's free, but to satisfy the law, you must be registered. As a pharmacist, if you have a valid license from a state licensing board and you are employed at a facility with a valid DEA number, then you must be registered with the PMP. So we know that prescribers and pharmacists have access to the PMP. What are some other folks that have access? Well, as a prescriber or a pharmacist, we know that you're busy, and you can actually assign delegates the task of pulling patient reports if that would help your workflow in your office. So delegates have access to the PMP. One thing to keep in mind, if you have somebody in your office that's pulling reports using your account, then you are breaking the law. Everybody needs to have their own individual account, but delegates are very easy to set up, and we do have videos, and I'll talk a little bit about that a little bit later in the presentation. Licensing boards, the medical board, the Board of Pharmacy have access to the PMP, and this goes back to if it is deemed necessary that information from the PMP will be used in an open investigation, then they have access to that. And also medical examiners. So the folks on the left of the screen, they have direct access, meaning they can go in, they can put in information, and they can pull a report. The folks on the right of the screen actually have access, but it's indirect. And what I mean by that is law enforcement has access to the PMP, as do other criminal justice agencies. They can request a report, but we do not release that report until they have given us an affidavit with the correct information on whom they're searching. And it must be searched in an open investigation. That's that criteria. Medicaid fraud investigators have that same, where they need to use the affidavit. Attorneys can have access to the PMP, but it must be through a court order. We do not accept subpoenas. So if we receive a court order, we will send that information on. Now also, individual patients, the public, have access to their own PMP records. We have a form that you fill out, you have it notarized, you send that in with a copy of a valid, clear copied government issued ID, and then we will release those to the public as well. So we talk about who needs to be registered. When do you need to pull a report? If you're a prescriber, and if you're going to be prescribing an opioid or benzodiazepine, you are required to pull a patient report. It must include the preceding 12 months, which is the default report length, so that is not a problem in that regard. That's very easy to do. You must pull it for each initial course of treatment. So keep that in mind. So you're not, if you're seeing a patient monthly for the same problem, and they just need to renew their prescription, you don't need to pull it. But if it is ongoing treatment, you are required to pull it every 3 months during that treatment. Okay? There are exemptions when reviewing a report. If you are dealing with a patient who has a cancer diagnosis, if they're in an ED, they have a traumatic injury, pulling a report might not be the most advantageous thing to do at the moment. If they're dealing with somebody who's in hospice, palliative, or end-of-life care, a skilled nursing facility, or a medication-assisted treatment. These are when you are exempt to pulling the report. For pharmacists, it's a little bit different, and we like to point this out. If you're a pharmacist and before you can dispense a Schedule II controlled substance, you must pull a patient report. Now, this requirement is a little bit different than the prescribers. And the reason why we bring that up is we're hoping that when a pharmacist pulls a report, maybe sees something that they have a question with, they would reach out to the prescriber who might not have seen that information because the requirements are different to look up a report. And of course, we talk about with pharmacists and their corresponding responsibility for the welfare of the patient. So again, we're always preaching it's a partnership, working together to make the best decisions for the patient. Appropriate uses for the PMP, it really comes down to provide medical or pharmaceutical care to a patient or to evaluate a patient. And really anything outside of that is not allowable, should not be done. Again, we talked about in law enforcement, licensing boards, it has to be part of an open investigation. When is it inappropriate? Curiosity. Let's say that your daughter is dating and a young man and you want to check up on him. You do not have that medical provider-patient relationship. You should not be looking at that record. Many times we have, especially government agencies, ask us about having it being a part of an employment screening. It is not part of an employment screening. It is an inappropriate use. If it is used inappropriately, we will let you know that it is a Class 6 felony and there could be repercussions. The tool itself will keep track of who you look up. It's an electronic record, and we do have that. So we just ask you to keep that in mind. These are patient records, and they should be treated accordingly. So there are some advantages, of course, to using the PMP, and the first one, of course, is it gives you the most information you can when you are dealing with prescribing some serious medication. In fact, working with a lot of associations, medical associations throughout the state, and some of the bigger medical providers, facilities like hospital chains and that type of stuff, a lot of them are making the PMP either a best practice or a standard of care, with the caveat that not every situation is required, but it is leaning more towards being used more. We have seen with the increased use of the PMP that it is making an impact on the opioid epidemic. It does help you identify and deter and prevent abuse and diversion of prescription-controlled substance drugs. On a more personal note, if you are a prescriber with a DEA number, you want to safeguard that DEA number. There is a report in the program called MyRx, and when you pull that, you can see all of the prescriptions that were dispensed using your DEA number. And we recommend that users do that maybe monthly or every so often. What it is, typically what happens is when somebody runs this report or they suspect that there has been maybe some inappropriate use with their DEA number, they give us a call. What we do is we would have you call the pharmacy and just make sure that there wasn't anything done incorrectly with the input. We're humans. We know that things are inputted incorrectly. It's the pharmacy's responsibility to do it. For the most part, that takes care of the problem. It's fixed. It will be fixed in the PMP, and then you're good to go. There are instances, though, where there has been some things with your DEA number that have been used illegally. That's when we have you reach out to local law enforcement. They know what to do, they know how to take care of it, and they will take the appropriate steps. So let's go a little bit away from the PMP and talk about some of the, just kind of remind you some of the prescribing limits that we have when it comes to Schedule II opioids. And we're talking about Schedule II opioids here. The initial prescription, if you are prescribing Schedule II opioids, can be not more than a 5-day supply. Studies have found that once you go past that 5th day, the chance that there might be a problem with abuse and with the Schedule II controlled opioid, it just goes up much, much greater. And for a surgical procedure, there is a limit of 14-day supply. There are daily MME limits for Schedule II opioids. It can be no more than 90 MMEs per day. As a medical professional, if you feel that 90 MMEs prescription would be warranted, by law, you must consult with a board-certified pain specialist before prescribing that. If you are a board-certified pain specialist, you do not need to consult with another board-certified pain specialist. Also, when giving this prescription to a patient, there must be an accompanying prescription for an opioid antagonist like naloxone. And again, this is required by statute. There are prescribing limits exemptions, and these are going to look a little bit familiar. And as you kind of go down the list, you can kind of see why these exemptions are in place. Again, it's that balance between getting needed medication to good patients, and unfortunately there's other people that abuse the system, and it's dealing with them as well. So there is a situation that I want to talk about that we get a lot of questions on. I mentioned that the PMP is made up of dispensations from pharmacies. There are instances where prescribers will dispense controlled substances from their offices, and there are some requirements in statutes that we want to remind those who are in this situation. First of all, you may no longer dispense Schedule II opioids. Medication-assisted treatment programs are exempt from this. Also, if you dispense Schedule II opioids, you have the same requirements that are in place that the pharmacies have. And what I mean by that is you must report daily. You must report all your controlled substances that were dispensed. If you don't dispense in a day, you must upload a 0 report. If you are in this situation and you're not reporting, you can reach out to us. I have some contact information at the end of the presentation. We will let you know the software that you use. It's free to use. We'll get you connected to the people that can help you with that. So we are done with the law portion of the presentation, which is always a little dry, but let's talk about some ways that we can help with folks to improve the number of people who are using the PMP. I want to talk a little bit about integration. Now, integration is not EPCS. It's not electronic prescribing of controlled substances. Integration is exactly what it says. If you are using a electronic health record system or a pharmacy dispensation system, when you are integrated, you can get your PMP records for your patient while in your EHR. So instead of going through all these different steps, you're able to do one button and have the information that you need. And this is called integration. Kind of a couple things to keep in mind is if you're not integrated yet, it's something that we are advocating very strongly. It is the Board of Pharmacy is helping with the cost of the connection right now. But keep in mind that integration, it's not mandatory. It's not like EPCS where, in a couple of weeks we're going to be have that mandatory use. So if it's something that won't work in your practice or in your facility, then it's a nice to have, not a need to have. Also keep in mind too that even if you do integrate the AWARE system, which is the portal that you use to connect to the PMP now, would still be available on the website. If you have any questions about integration, we have a really good web page set up with a lot of information. You have FAQs. There's a process that you need to go through to get connected, and we sort of help you as the PMP team kind of shepherd you, get you connected to whom you need to work with our vendor. But there's forms that you need to fill out. There's some terms and conditions that will need to be signed, but you'll find all that here on the integration web page itself. Another way, if you are finding this difficult to integrate, I shouldn't say integrate, to add your, looking up a PMP into your daily workflow when you are treating and helping patients. As I said before, you can set up delegates, and we do have training videos that are very short that will teach you how to do this, but basically the delegate has the access to go in, pull the reports for you, and get them prepared for you, so when you are seeing your patient, you have the report there. One thing to keep in mind that as the medical professional, and what I mean by that, if you're their prescriber or the pharmacist, you give access to the delegate. You can also take it away with the delegate, and ultimately you are responsible for what the delegate does search for. So keep in mind that you want to make sure that we've got them trained properly. They understand the gravity of not going in and surfing different records and that type of stuff. But it is a way that a lot of people have used to improve the workflow and having access to the PMP. So the ultimate goal of the PMP is really the well-being of the patient. And we have seen that the PMP, when using it, we do get results. The medical professionals have more information. They can make better decisions about the care of their patients. It's also had an impact on the opioid epidemic itself. We're seeing less pills, less doctor shopping. The prescriptions are not as, the ultimate would be to, use as little of the controlled substances as possible to make your patient, comfortable and get through what they need to get through. But one thing that we are finding, and it's still troublesome, is that, of course, we're still seeing that deaths from the opioid epidemic continue to rise. We know that the PMP is not a silver bullet. It has its place, and it's doing its, fulfilling its purpose, but that can make challenges for other people as well. And so, of course, we're seeing a lot of, folks going from prescription pills to illicit drugs itself. But there are some additional resources you have out there to help you when you are helping your patients itself. And one that we like to herald is the Arizona Opioid Assistance and Referral Line. And this is a line that, as a medical professional, you can call, and you would be working with other medical professionals. It will provide you real-time patient-specific consultation. The great thing about it is that it can help you with safe prescribing limits, if you identifying dangerous drug combinations. And one of the probably more important benefits that the OR line can do for you is if you have a patient that you feel needs some additional assistance for a possible opioid abuse disorder, calling the OR line, they will provide a warm referral to a statewide treatment center for your patient. So that is a big bonus. It's free to use. It's in the same location as poison control, so you get the same type of service. One other thing to keep in mind as well is naloxone access. Of course, we know that when naloxone is available and people know how to use it, lives are saved. Dr. Chris, the Director of Health Services, has issued a standing order authorizing any Arizona licensed pharmacist to be able to dispense naloxone to whoever asks for it. So that is something that we want to make sure that people understand and are made aware of, that it is available. A very important one for prescribers, there is the Arizona Opioid Prescribing Guidelines, and if you have not had a chance to take a look at this, I highly recommend that you do. This was put together kind of out of the Arizona Opioid Epidemic Act. Of course, there was a lot of different players that came together. And really the purpose of these guidelines is patient safety and also just reducing the risk associated with using controlled substances and the possibilities of that affecting the patient. They provide and assist providers with treatment decisions on when you're dealing with, when you are treating acute pain or chronic pain. They also have risk mitigation recommendations to help with the safety of patients, and one of those recommendations is the use of the PMP, so that's why we herald it. You can order a copy, a PDF copy at the Arizona Department of Health Services website. You can also order physical copies of these to have around your office or your practice, so it's something that we highly recommend. So I've thrown a lot at you. I know that webinars, it's a kind of a one-way street for a little while, but I do want to let you know that the Arizona State Board of Pharmacy, the CSPMP website, we keep it up to date with everything that's going on. A couple of big things, of course, that are happening here in the next little while. We have EPCS, and we're working to have our resources ready for when EPCS starts January 1, 2020. We are also starting a new legislative season, and that's always something that you want to keep an eye on because there are changes that happen in that regard. And probably most importantly, and I'm proud of the team that we have here in the sense that there is contact information available on there. We're very good at getting back with you. You can email us, you can call us directly. We will answer your questions and anything that you need. If you have any questions that I can't answer or don't answer today, feel free to reach out to us through this website and we'll be able to take care of you. And then one last thing, and I mentioned this a little briefly, we know that you're busy. We know that we want to have the resources there at your fingertips. There are things that when you're working with a PMP that you might or might not know, and instead of reaching out to us, we've actually created some very short training videos that you have access to 24/7. If you want to register a delegate or if you want to register, it will let you know how to do that. Requesting that patient report that we talked about and then how to read it. For prescribers that are on the line, there is a video on how to pull and look at your MyRx report that has that list of your DEA number that was used in the dispensation. So we highly recommend that if you do have questions, this is one place that you can go. Okay, a lot of information sent your way. Sarah, let's open it up for questions. I will say that for the folks out there, if you are more than welcome, you see my email at the bottom of the page, L. Curtis. You're more than welcome to reach out to me through email, or you can call as well. I will get back to you with any questions that you have. Sarah, do we have any questions? Or if you open up the lines.
Thank you, Lynn. If you have any questions, I do not currently see any in chat, but you're welcome to use the chat feature, which looks like a little balloon, or you're welcome to unmute yourself using the little microphone icon within WebEx, and go ahead and ask your questions.
Sarah, am I that good of a presenter?
I think you are. I think we'll go ahead and close the questions, but if you think of any and you place them in the chat, we'll go ahead and get those over to Lynn, and he will respond. Just let us know who you are and your best contact method. Thank you, Lynn.
Sarah, absolutely. Sarah, let me just give one quick little plug. Again, we know that EPS is starting. Health Current has been wonderful at the educational piece and helping folks. We are working on FAQs here. So once you are in the, after the first of the year, you do have questions, Health Current is a great resource. We will have resources at the Board of Pharmacy, CSPMP site as well, so keep that in mind. Yeah, I appreciate your time. Thank you so much. Reach out to me if you have a question. And Sarah, I will send it back to you. Thank you so much.
Thank you. Appreciate you doing this for us, Lynn. I'm going to go ahead and introduce Eric Zimbaum with Dr. First, and he's going to provide a demonstration of an e-prescribing app through Dr. First. So thank you, Eric, for attending, and I'm going to go ahead and change your role to presenter.
Thank you very much, and bear with me as I share my screen. And hopefully that is now pulling up. And yes, you can see. Okay, good. Thanks, Sarah. And so, hi, my name is Eric Zimbaum. Work for company Dr. First. And just the reason we have partnered with Health Current is because we were one of the original companies to actually create e-prescribing, and then we were the company that worked with the DEA to actually be able to create the technology to send controlled medications electronically. So what's referred to as EPCS, stuff that we created. And so that's why we're involved in Health Current has invited us. So I appreciate it. And really, the point of today is I want to just show you, frankly, how easy it is to send the prescriptions electronically, because I know there's a lot of fear in the unknown and that this could be a difficult process. But frankly, as you'll see, a lot of this is pointing and clicking, very intuitive stuff, and in the long run will make your life a lot easier. What I am going to show first is the ability to do this via an app on your smart device, and then I will show a demo on what this looks like off of your PC or laptop, and I'll go a little more in depth into sending the controlled medication, two-factor authentication, a few of these buzzwords you've probably heard about, and I'll address that in depth. The app, what I'm going to do is enlarge this. I don't have the best demo available, so what I'll do is I've got a brief video. I'll show you this, walk you through it, and just kind of talk to the video itself. So what you're just going to basically see is the ability to send prescriptions, send a controlled medication. This at first is simply showing the ability of pulling the patient. It's very easy. What you'll notice here, or what just went by, and I'll address it again, is the ability of the PDMP can be incorporated within your e-prescribing workflow. So that you can actually check the PDMP, send the prescription, and do all of this from one page and get credit from the state. But kind of what you see here, again, it's just showing easy use. All the medications are in here, the dosage amounts, etc. And as you can see, it's frankly just a lot of pointing and clicking, quantity, pharmacies you can go to, etc. You're simply going to point at it. So that's what it's showing here. Pharmacies will be able to easy to pull down. Formulary information will be included. I'll go into a little bit more of what that entails. but this will allow you, like I say, to get a visual of how you would do this from your phone. And pretty straightforward stuff. And then what we're going to show here is sending the controlled medication. It'll give an example of the two-factor authentication here. You'll put in a passphrase and a token number. On the demo I actually do, I'll go a little more in depth in that. But here again, it's just showing you what it looks like from the phone. And you can do this from anywhere that you're at. So, and same idea, the quantity, etc. And then here it'll say sign and send, and it will route them to enter the passphrase, enter the token, and so you can get a visual of what that looks like. And this passphrase is something that we help you create when you get set up. So it's something that always stays the same. This PIN number is actually coming off of a physical token. It's associated with your MPI number. So it's how everything that's being recorded on the back end, this is what is making it DEA compliant. So now the prescription's been sent. It'll give us a brief example of once you send the prescription, you can then send a quick message to the patient. Hey, this has been sent to such and such pharmacy. It's ready to be picked up. Do you have questions, etc.? This is all on a secure message system, so it's all HIPAA compliant. And then the great thing about this is, while you can initiate the conversation, it's a time lapse. So if you reach out to somebody to check on them, they can't then respond, let's say at 1 in the morning, or just start calling you or texting you whenever they feel like. So it's there for the convenience to provide patient safety and improve that encounter. But like I say, they can't drive you nuts with that communication. So anyway, that gave you a gist of what it looks like sending it through an app. This is what it looks like if you were to work off of your desktop and laptop. And so I'll actually show you a few examples of sending the prescriptions. I'll go a little more in depth in the two-factor authentication, but just give you an idea of what this looks like. So what we're looking at here is everything is on one page, so you don't have to navigate around. Everything will be available just, like I say, right here. You're going to have the patient name. You will have the pharmacies located here. We're going to pull up the pharmacies that that patient typically sees. If for some reason it's not in there, you want to send it somewhere else, all the pharmacies, all the mail orders, mom and pop, etc., all of that is in the system. 99.9% of these pharmacies are now connected, and a lot of it is due to these state mandates. And it's an easier workflow for them on the pharmacy side, they've discovered. Here on the right-hand side, we'll provide formulary information. We will pull this up for you in real time. It's not for billing purposes. It will let you know, hey, does the medication, is it covered by the insurance company? If it's not, we'll provide a generic alternative. There's an example of that when I do a prescription that will pop up. And then we take it a step further now, too, where you'll actually get a pop-up. And sorry, I'm just kind of a box in the middle. There's not an example here, but once you have pulled the medication, a box will pop up and it will list all the pharmacies that patient typically goes to and give you a price for the medication. So you can direct them to the place that's most economical for the patient. So all that information will be there. And like I said, it all is on one page. And then I referenced the PDMP. Essentially what you'll have is a button that is similar to, let's say, this patient merge or this modify button. You'll click on that. It will pull up the PDMP screen. You get credit for the state PMP, and then you can send the prescription. And then actually sending the prescription, sorry, let me back up real quick. What you'll also see is that you can add allergies, and then to the right here, you can add diagnosis. You don't need to, but it's there for your own, it's flexible, so you can add that if you like. So what I'll do is I'll send a prescription. As you'll note, I've got Cara Whiteside here on all sorts of medications. So yes, I know Adderall, Xanax, Oxycodone. Yes, those are not the prescriptions for an actual patient. It gives the best example. It's a bit redundant, but I'll use Adderall a few times because it does give the best example of what I'm trying to illustrate. So just in terms of sending a prescription from a PC, it's just as easy as what you saw off of the app. We're going to have a lot of pointing and clicking. So in this case, probably the most often for you is going to be, it's a current patient. We are going to renew the medication. And it's frankly as simple as just clicking this renew button here. And what you'll see is that this medication will be pending. And here's one of the alerts I was commenting on. So I'm going to go ahead and click prescribe anyway. Here's a formulary alert that I mentioned. So it's indicating what is covered by the insurance company. Like I say, there's this button here where I can go ahead and click prescribe anyway. We'll give you alerts, but you as a provider, it's up to your discretion on sending the medication or not. So now, sorry, we're on the same patient page. This medication is now pending at the bottom of the page. The medication will stay there indefinitely. It will stay there until either you send it or you can cancel it. The reason for this, though, is you can have staff essentially do everything for you, enter patient demographics, queue up meds, etc. And then the provider can have as little involvement as just simply going in at a later time and releasing the controlled medications. And I'll show you once you pend it where that goes in terms of a list for all the patients. But this is what it looks like. The Adderall is now here. I'm going to enter a signature password and click send. Now, if this was a non-controlled, like an amoxicillin, etc., it would have gone to the pharmacy right then and there. The controlled medication, we take it a step further, and this is the two-factor authentication part of it. So as you saw in the app, I am going to enter my passphrase that I use, and this is something that stays the same. We help you get that set up. And then there is the token PIN number. So what I'm actually doing right now is I'm opening my iPhone, and I'm pulling up the token that I'm being provided. So it's giving me 915289, and now I'm going to sign and send. And so now the prescription will be sent. How I know it's been sent, there's two ways I know this is gone to the pharmacy. One, right here, right in the med history, right here on the right-hand side, I'm circling. It notes 12/18, so today's date. And then you'll also have the ability to pull reports. So you can pull in-depth reports based on prescriptions, on medications, based on provider, practice. Everything is time-stamped. It will show you date, time, initials of whom sent it, etc. But this is the immediate way you can see it is just the med history that it was in fact sent to the pharmacy. And then it will go to this pharmacy listed here. So that's how you renew. The two other ways you can prescribe, you can create a favorite. So I'm up here in this upper left-hand corner where this star is. I'll open this drop down. And then these favorites, you'll be able to create. You can create it practice level, provider level, and then it will keep track of the most recent prescriptions that have been sent. And so from here, all you have to do is point and click. And as you can see, you can create this based on medication type, dosage amount, quantity. You can do compound medications. You can put in special instructions, which I'll show in a sec, etc. And all of that will keep in your favorites. So again, the idea is you can set that up, and then you're just pointing and clicking and sending these scripts. The third way you can prescribe, I'm right here to the left of that create new prescription, is starting this from scratch. So I'm going to show you an example of what this looks like. And again, I'm just going to use Adderall. Gives a good example. As you can see, I type in the first few letters of the medication. It will pull up a list of the different meds. I'll click on the Adderall instant release, and then I get all the dosage amounts. It's telling me brand is not covered by insurance, but generic is. I'm going to click on the 20 milligram. I'm going to get that pop-up alert here again about the formulary. Sorry for this. So I'll prescribe anyway. And now I'm on this signature screen. And all this is an electronic version of your prescription pad. So how you take the medication, how you prescribe, et cetera, will all be in these drop downs. It knows the type of medication you're using. So for instance, Adderall, it says take, it will provide tablet. If it's an injectable, it will give that option in the drop down. Tells you how you can take it, so it recognizes the type of medication. We'll go twice a day, as directed. You can put directions to the patient in here, so you can free text. I'll put in a quantity here, and you can put in directions to the pharmacist. So like I say, if you're creating a compound or you need special directions in terms of easy bottle to use or something to that effect, you can put those directions in here to the pharmacist. So then I'm going to go to the bottom here. I'm going to review the prescription. Here's another alert. I'll prescribe anyway. And now you can see everything in this border here. I apologize for this pop-up. You can see in this border here all the information we just put together on the previous screen. And you can see the take with food. You can see the X's I marked for directions to pharmacist all show up. And then this is the view that they get on the pharmacy side. So from this screen, you can send the prescription. I'm actually going to append it. It's going to take us back to this main patient page. And now this medication is queued up at the bottom of this patient page again. I'll go through the steps again real quick just so you can see this two-factor authentication. And I do that just because I get a lot of questions on that. I'll click send. It's going to ask me for my info. And bear with me as I log into my phone because this PIN number will change every 30 seconds. But like I say, it's associated to the MPI. And so that's how it knows what number to give you essentially. So I've typed that in. I'll click sign. I'm going to get a message that this is duplicate therapy. So I'll get that. Oh, no, it didn't. I apologize because I had a different dosage amount. Okay, so and then I could see here that it was in fact added to the medication history. So it did send that through because it was a different dosage amount. So 20 milligram versus the 10, which I originally had. But anyway, you get the idea. I wanted to illustrate what that was all about. Two other items I want to point out. One, I mentioned the ability to pen these medications, and then the provider can go back at a later date or time and release them. Up here in the upper right-hand corner, you see this bell icon. So I'm going to click in there just to show you what this looks like. And these would be all the pending medications from your practice. So everything that's been pended but not sent. And so you can send all the non-controlled in bulk. It will make you enter a token number and your passphrase for each controlled medication script. That's a DEA regulation. However, if for some reason you are sending multiple controlled medication scripts for one patient, you can send that in bulk. But like I say, you can go back and send this whenever you like and release it. The other item I want to show you is right here to the left. And this is where a refill request will come from the pharmacy. So the patient goes into the pharmacy, they need something refilled. The pharmacy can reach out to you electronically versus a phone call. And so it will come this way. You can respond, you can fill it, you can deny it, you know, whatever is appropriate. Again, you can put in a message to the pharmacist and then send it back. Go back to this main page. So those are the two main things I wanted to show you regarding that. Lots of bells and whistles. There's electronic prior authorization, so you can contact the insurance company electronically versus fax and call. Like I say, the PMP is built in, etc. But this gives you a gist of what it looks like, ease of use, etc. So I will leave it open to any questions you may have.
Thank you, Eric. We do have one question on chat from Barb asking how much the software costs.
Gotcha. Yeah, so we have got, it's an annual fee. It's per prescriber. Staff does not charge. Typically, it's $7.99 per year. It's $7.19 per year. Because of the mandates, we give 10% off. And then that is for the web service and the app service. And then we've got a further discounted rate if you just want to use the app. And I'm going to pull this on. Sorry, my contact info, I apologize, very rudimentary, but I lost my slide, but this at least gives you my email and phone number that you can contact me directly. But that gives you at least a price point. So it's not an exorbitant cost. That's not a whole EMR system. It's, you know, it's the $7.19 per year, and then staff is free.
Thank you. Do we have any other questions from any of the participants? Okay. Well, I thank you, Eric, for giving us the demo, and I appreciate everybody attending, and this concludes the EPS webinar.
Thanks, everybody.
Thank you, Eric, for attending and showing us.